Well, Ms. Schwartz, I looked at your physical exam. It's perfectly normal. Your heart exam doesn't show anything that would suggest any increased risk. Your family doctor sent us all your laboratory data, and it's excellent. Your cholesterol's low, your blood pressure's normal, you're not a smoker, you don't have diabetes, you're exercising every day. All those things are good things that put you at very low risk for any kind of heart disease, and also put you at low risk for the outcome of this surgery. I think you're going to get through the surgery without any problem. And in fact, trying to add another test to this isn't going to improve your risk assessment. In a sense, you've got enough good risk data now that the stress test isn't going to add anything more to our risk assessment for your surgery. So my recommendation is that you don't need anything else. You can get through the surgery successfully and not expect to have any problems with a cardiac problem from the surgery.
Well, I still feel I would be more comfortable if I had a stress test.
What is it that makes you uncomfortable about the recommendation that you don't need a stress test?
Well, my mom, she was like 84, had a heart attack and died. So if I think I've had the stress test and I had positive outcome from that, I would feel much more comfortable going into my surgery.
Okay, I can understand your concerns. I mean, it's your mom, and she died from a heart attack,
yes.
And here you are worried about it. Now,
right.
If we look back at your family history, your two sisters and your brother, about the same age, no heart disease in your siblings, no heart disease in the rest of your family.
No.
And when we look at age-related heart disease, somebody that's 84 is at a much higher risk to start with just because of age. So it doesn't really count from assessing your risk. And I think from the standpoint of your family history, I would say it's a very benign family history that is not going to put you at risk from that. So from that standpoint, the way I can understand your concerns, at least in the family history area, given all the other things being negative, that would not make a big contribution to assessing your risk or putting you at risk for this surgery.
Well, that puts me a little bit more at ease, but I still feel that I need that stress test.
Okay, so there are a couple different kinds of stress tests. I mean, the normal kind of stress test from your standpoint would be get on the treadmill and walk while we measure your cardiogram.
Right.
I always have a little concern about the accuracy of that, particularly in a woman, and because there's a little bit of inaccuracy in the test, and women have a little more likelihood of having an unpredictable stress test. And in that circumstance, we like to add something that I would call imaging to the stress test. Very common thing to do. It's either an echocardiogram image or a nuclear image. Common is a nuclear image. Nuclear images add radiation. They require an injection during the stress test. And we've been trying to convince patients that they don't need those kind of tests for a couple reasons. One is it doesn't change your outcome predictability. And two, it produces some risk from long-standing accumulation of radiation. So there's a couple reasons we don't like to do some of those advanced kind of stress tests. And so from the standpoint of a regular exercise stress test, we may not have enough accuracy to change the already low risk predictability that we have from your clinical data. So I'm not sure it's going to add anything. And again, it could add risk in the sense of the kind of tests we do. So again, I would strongly recommend that your outcome is going to be excellent and that you don't need anything else done to be able to predict that outcome.
Well, I'm not looking to have a needle injected for sure, and I certainly don't want to subject myself to radiation if it's not necessary. So I guess not having the stress test sounds like a good thing now. And I feel a little more confident going into the surgery that everything is going to be okay without subjecting myself to further risks of a stress test.
Okay, so now when you meet your friends who've had the stress test, you're going to need to answer some questions. So I'll give you some literature that you can tell them about that shows that this is not going to add anything to your already low risk predictability.
That would be perfect for myself and to be able to explain to others. That would be really great.